Well, I've been a nurse for just under a year and a half, and I definitely didn't imagine that I would be working during the pandemic. I had pictured that maybe sometime in the future I would work during a pandemic, but definitely not this early in my career. I'm Sky, and I'm a palliative care nurse. I'll tell you just a little bit about palliative care. So it's mostly end of life care and symptom management for people who mostly have cancer or some sort of life limiting disease. So, since COVID came about earlier in the year, there's been a lot of changes in my workplace and the whole organisation that I work for. For starters, there's been PPE introduced, so I have to wear a surgical mask and face shield or goggles at all times at work. It provides really great protection, but it can also be really challenging to have to wear that all day, every day. Then there's also been changes to the visiting hours on my ward. So previously, people could come and visit their loved ones at any time, all times. However, now there can only be two people in a particular time period, and when someone's nearing the end of their life, they can only have one person at the bedside. So that in itself is very consuming and challenging for the patient and their loved ones. As nurses, we tend to become pseudo family members because their family members, the extra family members, just simply can't be there. To touch on one example, during the week last week, I cared for a man coming to the end of his life, and when he passed away, I had to watch his family mourn the loss of this man through the window. So I was inside the room with two family members, and I was consoling these people with the loss of their family member while the family watched through the window. And that is really hard for us. Myself, I haven't been in contact with anybody or any patients who have had COVID-19. I've nursed lots of people with suspected COVID, not confirmed. So I have had to wear a lot of the PPE and treat them as if they were, but no actual positive cases. So at work, the hospital is definitely treating COVID very seriously, to the point where it can be a little bit frustrating at times. There's lots of loopholes that we have to jump through and lots of precautions and safety measures in place. But definitely, I think that they're taking it really seriously. The pandemic has greatly affected my mental health. It's been an extremely challenging time. It's been very tumultuous, and much like a roller coaster, I've been okay, then not okay, and then okay again. But with it now being springtime, I'm feeling a lot better. At particular moments in time, I have been scared of contracting COVID, particularly because I have a comorbidity of asthma. However, that only lasted a short period of time, and I'm not so afraid anymore. I think once COVID is gone from Australia, there will be some normalcy, but it will never be the same. I think that Australia and the world has changed forever, and this will always be a very strong part of our history, but we will get to go back to our lives in some form, but it will be in a different way.